Good afternoon, everyone. My name is Vinita Mulchandani, and I represent the PCOS Society of India. It's time for some deep talks. This is a panel discussion on PCOS and infertility that we are having. The PCOS Society of India is focused on creating awareness on PCOS. The society consists of a large membership of multidisciplinary physicians, such as gynecologists, endocrinologists, dermats, and all allied health specialists such as nutritionists, physiotherapists, etc., who deal in PCOS patients. Vijayata, the winner. This is a PCOS initiative. Vijayata, the winner, is the outreach arm of the PCOS Society of India, which has been conceived to educate women regardless of whether or not they have been diagnosed with PCOS. We believe that understanding PCOS is essential for supporting women's health and well-being, especially its impact on her starting from puberty to beyond menopause. The aim of this program is to raise awareness and share knowledge about its causes, risk factors, symptoms, and management. The most important aim is to dispel the myth surrounding PCOS. So, what is PCOS? It is an acronym for Polycystic Ovarian Syndrome. 1 in every 5 Indian women suffer from PCOS. It can occur at any age, starting with the first occurrence of menstruation. The majority of women are diagnosed as PCOS between the age of 20 and 30 years. PCOS is mostly frequently observed cause of female infertility. Let's start the discussion. But before we do, let me introduce you to our panel of doctors, starting with the moderator, Dr. Sandhya Saharan. She is the immediate past president of the Thane Obstetric Society, Honorary Joint Secretary, PCOS Society of India, MCM, PAC, FOXY. Special interest in endoscopy, PCOS, infertility, yoga. She's also a consultant obstetrician gynecologist with hospitals such as Jupiter Hospital, Thane, LH, Hiranandani Hospital, Kaushalya Medical Foundation, Curie IVF Birthing Center. Awards, she's been awarded, she had several awards, as you all can see. Young Scientist Award in 1994, Device Nonograms for Labor Monitoring, recipient of HDSA Silver Jubilee Award 2001, Best Paper International Congress on Fertility in 2003, Bharat Jyoti and Best Citizen of Indian Award for 2007, Peer Reviewer Jogi since 2014, Golden Healthcare Achiever Award, Salam to COVID Warriors Award for 2021, IMA Olympics 21 Badminton Gold Winner, Thane Citizen Pride Award 2022, and LSM Teacher, Actor, Singer, Trekker, Organic Farmer, Environmentalist. Oh my God, Dr. Sandhya has it all. So we're very happy to welcome you. I will go on to introduce the next lot of doctors who are going to be the panelists. We have Dr. Ankesh Sahetya. He is a DNB, DGO, MBBS, MNAMS, FALS, FICOG, Fellowship in Advanced Laparoscopy. He's also an obstetrician and gynecologist, sexologist and endoscopic surgeon with Pushpa Hospital, Brilliance Fertility Center. He's a consultant with Hinduja Hospital, Cloud9, Surya Women's Hospital. He's an honorary with Oshiwara Maternity Home, ex-consultant Bandra Baba Hospital, ex-lecturer TN Medical College and Nair Hospital. He's a president in 2019-20 for Rotary Club of Mumbai Coastline, member of the Managing Committee, Association of Fellow Gynecologists. Publications are articles and chapters in various textbooks, membership of MOGS, FOGSI, IAGE, and AFG. His special interests are high-risk pregnancy, fertility enhancing laparoscopy, pelvic sonography, awards in MOGS, SAFOG, Best Endoscopy Video Presentation Award, FOGSI, MOGS, first prize in paper and poster presentation. Welcome, Dr. Ankesh. Moving on, yes. Dr. Nagadeepti Naik. She is the MBBS, DNB, OBGN, Fellowship in Reproductive Medicine, ICOG. She's currently associated with Indira IVF as consultant gynecologist and reproductive medicine specialist since 2016. She's contributed in various papers and chapters in various national and international journals. Committee members of PCOS, Youth Brigade Society of India, Indira IVF Ethics Committee member. She's the master trainer of Dhira, Violence Against Women, FOXY, along with UNICEF. Member of FOXY and ISAR. Welcome, Dr. Nagadeepti. Next, we have Miss Niti Desai. She's a consultant nutritionist. She practices in South Mumbai. She's attached to Kumbala Hospital since 17 years. She's a secretary and Association of Diabetes Educators, co-editor of IDA's Clinical Diabetes Manual 2018, and authorized chapters of various textbooks. Regular columns in health and nutrition for 18 years, and she was the official nutritionist for Femina Miss India 2018. Welcome, Ms. Desai. Lastly, we have Priti Chawla. She is a health and fitness coach, ACM USA, rehab trainer specialist, APA sports physiotherapist from Australia, barefoot training specialist, EBFA Global, Pilates from in the Pilates Institute of USA, metabolic and functional training, which is the ACE from USA, senior fitness specialist, NASM USA. She's also the aqua coach and Pilates trainer at the Wellington Sports Club, Mumbai. She has her own brand of natural preservative-free health foods under the brand of TWL, the Wholesome Living. Her passion includes high-altitude trekking and also distance open water swimming. Her motto is, keep it simple and do it because it makes you happy. Movement is the key. Welcome, Priti Chawla. So glad to see all the doctors around here. So without further ado and wasting more time, I know everybody is waiting to ask their questions. I'm going to put all the doctors on right now. Before I do that, people who all are actually watching this, there is a small question answer box which is given down. So please go ahead and start asking your questions on that side, typing your questions, and they'll come to me. And towards a little later, I will start asking those questions. So let's start. Dr. Sandhya, over to you.
Thank you so much, Vinita. And let's get on with what is this complex disorder called PCOS. So I'll put the first question to Dr. Nagadeepti. What is the correct diagnostic criteria for PCOS? See, we often get patients who come with a sonography report and they say, okay, now this is, my radiologist, sonologist has told me that I see multiple cysts in the ovaries. So doctor, I have PCOS, what do I do? So exactly how do we label a patient as a PCOS patient?
Good afternoon all. Thank you ma'am for the question. Basically, as said by you very rightly, because there are patients who just come with the ultrasound reports saying that, oh, I've got a polycystic ovary, or more than that, we have a Google internet to say that, okay, it is diagnosed with polycystic ovary. So, but basically that's not the way we have to conclude that somebody is having a polycystic ovarian syndrome. There have been many definitions throughout, but of late we have bable following something called as a Rotterdam criteria, which I will keep it very simple for you all, that it is like there should be certain clinical features of hyperandrogenism, like acne, hirsutism. Hirsutism is a hair growth in the male pattern, or there is something male pattern balding, which is called as alopecia. Or you also, when we do a biochemical testing of hyperandrogenism, like this, male hormones, which is on the elevated side. This is one criteria. The second is where the female experiences irregularity of the menstrual cycle. That is where the cycles are not coming regularly. That is, she experiencing her cycle every after 35 days, or in a year the menstrual cycle pattern is less than 9 cycles. This is called as oligoanovulation or irregular menstrual cycle, which we call in the general term. Or the next third is the ultrasound criteria features, where the radiologist diagnoses it as polycystic ovary morphology. That is, morphology means the picture of the ovaries depending on the ovarian volume and the follicle number. But we don't need to have all. Any 2 out of these criteria is sufficient to diagnose it as polycystic ovarian syndrome.
So that was a very comprehensive and a good complete answer, I guess. But we have different manifestations as you just enumerated. So Dr. Ankesh, I would like to ask you, do we see any difference in the adolescent PCOS, which is nowadays a very, rampant problem which we are seeing in adolescent girls, compared to adult PCOS?
First of all, hello everybody. Thank you for the question, madam. Thank you, Vinita, for the beautiful introduction of everybody. So definitely, madam, the girls who come in adolescent age group from the age of say 13 to 19, just before they turn 20, they come with symptoms of acne, facial hair growth, irregular periods. Majority of them who come to us, I have dealt with more of obese PCO. So definitely when these girls come to us, it's, the mothers come and say that since she's got her period, since Menak, it might be at 11 or 12 or 13, since then, her periods are irregular, and now she's 16, 17. Also, you can easily diagnose these people are not having a healthy lifestyle. The children have been prone to eating sweet foods, high carbohydrate foods. So they end up having signs and symptoms of obesity, acne, weight gain, facial hair growth, and they come for those aesthetic symptoms. Also, they're worried about their periods. In contrast to the girls who you said who come in the adult age group, who are most likely, around the age of 20, 25 up to 30, 32, they are more interested in regularizing their periods and also planning a family. So these girls eventually have, in their life retrospectively have been to gynecologists who have given them medicines to regularize their periods, do their hormone tests. They're very aware. They've done ultrasounds like how Dr. Nagdeepti said, showing PCOD, PCOS. So the difference between the two is the anovulation, which is absolutely established in the girl who's, in her 20s or early 30s who wants to conceive. She is not so much worried about facial hair growth and acne and hair fall compared to the girl in the adolescent age group. So that I would say is the main difference of manifestation and main complaint which they present with.
Exactly. So basically, the younger they are, they have, college-going girls, they have more of aesthetic concerns, because definitely nowadays body image issues are a huge thing. And there is a lot of taboo also regarding all this. So, but the older they get, they are more concerned about the reproductive aspect. So that is extremely well brought out. I'd like to ask, hello, Niti.
Yes.
Priti is our nutritionist. So as Dr. Ankesh has already enumerated, that we are seeing a lot of obesity and we are seeing a lot of, fat food kind of syndrome going on nowadays. So do you see a lot of spurt in the cases which are referred to you nowadays? Because generally what happens is when we get a lot of patients with this, they invariably ask us what is right food. And is it more of awareness of PCOS, or is there something like a PCOS diet? So would you elaborate on that?
Sure. Thank you very much for having me here. Very good afternoon to everyone. As you rightly said, whether there is a spurt in the incidence, yes, we definitely see the numbers kind of increasing. Yes, partly because there is more awareness and the diagnosis is more, but definitely also because of the change in lifestyle. We are seeing a lot of obesity, girls being overweight, childhood obesity, overweight, and even adult young girls being overweight. That also is obviously precipitating the symptoms of PCOS. And then, of course, which is there a PCOS diet? Well, PCOS diet is basically a healthy diet, but yes, in our context, in the Indian context, we do take a lot more carbs. We are a carb-loving nation. So we do need to look at our carbohydrate intake, our starch intake, and replace some of it with protein-rich foods. That gives us good weight loss. It also gets the hormones in place. And also make sure that the diet has all the food groups, the nuts, the seeds, the fruits, the salads, because there is no single pill which has all the antioxidants and vitamins and minerals packed into it. So a variety of diet in moderation is the key.
My God, that is really good. It's a complete bouquet of, dishes that we can make out of all these. So that's excellent. I'd go on to Priti. Priti is absolutely, all gearing up to take us through the exercise part of it. So as we already have heard that there is a lot of obesity and there are a lot of problems with the kind of food. So do you also see a lack of exercise being a contributory factor? And do you advise exercise for all these women? What kind of exercise?
Yes, thank you so much, Dr. Sandhya, and everyone too. Everyone has spoken about lifestyle. That is lack of diet, lack of good nutritious diet. Yes, lack of movement, I feel, is very, very big. I have a lot of young people coming to me, and it's just that I think what the most common misconception I feel is that where people feel they need to set apart a time for exercise. Yes, you do need to set apart a time for exercise, but besides that, you need to carry on movement throughout the day. So otherwise, like if you're exercising for like 30 minutes or 40 minutes in a day, what about the rest of the day? I mean, are we climbing the stairs? We never do that. Are we reaching out? Are we doing walk short distances? Always using a vehicle to even go short distances. Little things, walking the dog, whatever you can do in your daily life to move. I think movement is really always the key. And besides this, that yes, you must set aside some time for exercise for yourself. So if you're talking about the kinds of exercises, there's so much that one can do. If you're going to look at all the different components of fitness, some cardiovascular exercise where you walk, run, swim, jog, whatever you like, whatever you enjoy doing. Set aside at least, if not 35 to 40 minutes, at least about 15 to 20 minutes a day. Maybe just a good brisk walk, that's enough. Besides that, nowadays we have a lot of group classes. There's yoga, there's Tai Chi, there's Pilates. So a lot of mind-body exercises, which also kind of reduces your stress level. And then we also have strength training. Strength training is imperative, as we all know that helps to build muscle mass, helps obesity as well, increases your BMR. So a combination of all these exercises actually would be ideal. So maybe if someone could kind of make a nice holistic program for themselves that they can do throughout the week and then carry it forward, for
That's very important. Muscle mass, I guess, is something which is very important because we have two types of PCOS. It is obese versus the lean.
Right.
So many times what happens is there are girls who are little like on the leaner side, but still they have PCOS. So their mothers come and say, but she is so thin.
Yes.
So why does she need to exercise? So many a times we face that kind of dilemma. So how do you counsel them?
So, the way to kind of, firstly, you have to explain to them that exercise is universally important, whether, you're thin, fat, or however your body structure may be. The benefits of exercise. So that's another misconception that I do feel. Sometimes when people come to you, when I ask them what their goals are, they tell me that our goal is to lose weight. So if your goal is only to lose weight, then actually you need to see a nutritionist. Because the other benefits that you get from exercise are way beyond just losing weight. Like I said, increasing. Also, what about endorphins? So many people with PCOS, like they have a lot of stress levels are high. And all the other factors also we saw, like facial hair growth and acne and all of that, which kids really get worried about, especially younger people. So, endorphins, feel good, happy hormones, which you induce when you exercise, all of that kind of plays a part. So exercise as a whole really needs to be encouraged. And so that's how we motivate them. I generally tell them is maybe, especially if they're young, get a friend along or work out in a group. Because sometimes it's the energy of the group that kind of carries you forward. It's also very demotivating for people to exercise alone, especially if they don't like to exercise. And kids and teenagers. Nowadays, you see, we're all stuck to our gadgets. So it's so easy to kind of connect with people over a screen that maybe instead of meeting up for a meal, meet up for a walk instead. So that's a great way of connecting with people. So that's how just kind of and also I think start slow and gradually build it up. Sometimes too much too soon. What happens is that people generally start off with a bang and okay, they're all motivated and everything, and then within 2 or 3 weeks you say okay, now we're done, we've had enough and we can't do this. So giving up so if you set small goals for yourself and gradually build it up, I think you have a better chance of sticking to your exercise routine.
Absolutely. I think that is very important. Dr. Nagadeepti, we all know that since it is such a complex disorder, so many a times you need to work in conjunction with other specialities, a nutritionist, exercise therapist. Sometimes we also involve a psychologist when we have a lot of people who are depressed because of their body image issues and all. So what are the treatment modalities? Like how would you approach this complex disorder, especially many a times in the reproductive age group, they come with menstrual irregularities. So how do you approach
so basically, it again depends upon, as you said, the reproductive age group. Now, first question is the menstrual irregularity. We have to understand that PCOS is something which we cannot, like, you take some medicines, take for 5-10 days, it is gone off. You have to understand that PCOS is somewhere which is going to be there. It cannot be eradicated, which we have to be a part and along with the exercises, nutrition, diet plan, we have to manage it accordingly. So now if she say that she's planning fertility, then the treatment would differ. But if your main goal is right now only regularizing her menstrual cycle, then there are, after doing certain blood tests, investigations, when we know that most of her hormones at the body is, everything is fine, we can do something, give her something called as oral contraceptive pills, which can help her to regularize the cycles, where even along with diet management and nutrition. Now, in the oral contraceptive pills also, there are various types in it. We can use a third generation, which we generally say, where there are also anti-androgens. Then along with it, even acne, hirsutism can also be treated along with it. So if we are thinking of menstrual irregularity where she's not planning to conceive at present, I would say oral contraceptive pills with exercise and weight management, because it has been shown in many of the things that exercise, weight management has helped people to regularize. Even a 5% loss has themselves has helped to get the cycles regular on their own. So that has to be a part and parcel of the pharmacological treatment, not only medications.
That's really very important to understand that the crux is basically lifestyle modification, and then it comes on to any kind of pharmacological therapy. Dr. Ankesh, there are girls who come with these reports, like I said, there is an ovarian cyst. Suppose they just have an ovarian cyst, and they'll have a lot of questions like, what are the different types of cysts? Could you just enumerate for our audience, because we have nowadays, this is becoming a major problem in young girls. And there is something called endometriosis also. So many times they ask you like, will this lead to cancer? What is the repercussion? So how do you counsel them?
Sure, madam. Very good question. Very relevant to today's time. Thanks to social media, Instagram, Facebook, everyone's become their own doctor nowadays. Everyone's got YouTube access. Everyone's Googling surgical videos and coming to us nowadays. So, madam, firstly, very simple. The whole concept of cyst has to be explained. Now, these guys see a report. Firstly, very sorry to say, half the radiologists report any patient with PCOD, PCOS. I don't think they know the criteria also so well. As Nagadeepti was saying, the criteria, there's a fixed criteria of how a sonography should show a cyst. Now, if they say, we got patients coming and saying, Doctor, mujhe cyst ho gaya. That's quite, rural and how they think. But basically, if you have polycystic ovarian syndrome, there is a medical management with lifestyle, with a few medications, and with diet, exercise, as Priti also just said. Now, when this is cyst ho gaya, the most common one is the simple ovarian cyst, which is the follicular cyst because of anovulation, where one follicle of the previous cycle has failed to rupture and formed a single large follicular cyst, which can be tackled with OC pills up to 5-6 centimeters. Sometimes they have a hemorrhagic cyst, which again is because of the same reason, because of blood spill in the ovary. That also can be handled with birth control pills. Patient having endometriosis, which is actually a disease, which is actually a problem, they will definitely come with symptoms of, painful periods, very painful periods, irregular periods, intermenstrual spotting. They will, if they are trying to conceive, if they are in their 20s and early 30s, trying to have a baby, they will definitely have symptoms of infertility or pain during intercourse, dyspareunia. So the most common ones we see on practice, very rarely we see dermoids nowadays. We can see patients with dermoid cysts. They are not so rare, but they come with dermoids. So the most common three which we see, madam, on practice is a simple ovarian cyst, a hemorrhagic cyst, and endometriotic cyst. But endometriotic cyst will not only present with a sonography report. She'll definitely have some symptoms of pain. Even if a patient has a good pain threshold, you will see that. Otherwise, there are so many 100 kinds of ovarian tumors. I remember Praveen Matre sir's lecture on ovarian tumors would last for 6 hours. There were so many classifications. The serous cyst adenoma, mucinous cyst adenoma, but I would not go into that for today's talk. I would say simple ovarian cyst, hemorrhagic cyst, endometriotic cyst, and like I said, a dermoid cyst. This is what I would see, and all can be tackled in their own ways, but definitely endometriotic cyst and a dermoid cyst would be requiring a surgery like a laparoscopy and enucleation. If the patient is planning to conceive or she has symptoms of pain, that's what I would recommend.
Yes. So coming to that, in the olden days, like when we used to have all these polycystic ovaries and all, and especially when they would present with infertility, there was something called a laparoscopic drilling. It used to be done very long back, saying that, you have to debulk the ovaries. But now, lately for the past 1 or 2 decades, it is basically not being done so often. And it is only in a few cases at a second asks you, doctor, do I need to get a surgery done? Being an endoscopic surgeon, they must be coming to you that, do I need to get these cysts operated and all? How do you basically tell them, like, that these really do not need a surgery, and how do you counsel them?
Yeah. So definitely, madam, I have not seen. Am I audible to everybody?
Yes, now, yes.
Yeah. So basically, since the last 7, 8, or maybe 10 years, I don't think anyone has called me or have seen or done a PCO drilling. It is a thing of the past. The earlier guidelines where the Royal College would say to, rule of four perforations on the ovary at 40 millivolts, 4 millimeters apart for 4 seconds. All that is gone now. You can grossly damage the ovarian cortex, the AFC, the AMH by doing PCO drilling. I don't think it's required at all. If a girl is trying to conceive, if she has a PCOD or enlarged ovaries, you can treat it medically and with lifestyle management. There is no function of this procedure at all. There's no surgery to remove the cysts. People are all, over here, there's all misconstrued conceptions that cyst nikal diya. That for a larger cyst, like a simple ovarian cyst or an endometriotic cyst or a large hemorrhagic cyst. For PCOD, there's no surgery at all. Very often people do diagnostic hysterolaparoscopies and they just see the dye passing through the fallopian tube and they say, look at the ovary, and they want to drill the ovary. It is not required. I don't recommend this to anybody. You will grossly damage her cortex. You will damage her AFC and EMH, and you'll in fact worsen her chances to get pregnant. So don't do this surgery for a PCOD drilling, is what I would suggest.
So that's a very take-home message, very important ones, because we have a lot of people who come and they insist, doctor, no, I need a surgery. No, it is not required. He is very elaborately mentioned as to why it is not required also. So we go on to Niti. Yeah, now we have all these kinds of, like people are desperately trying to lose weight, as they have all enumerated that weight loss does help. It, helps in regularizing the periods. It helps in a lot of, manifestations of PCOS are definitely lesser. So what are all these, we hear so much about the keto diet, the Dikshit diet, intermittent fasting. I mean, how would you sort of, segregate, and how would you tell us what is what and what is required?
Right. So, yes, I think these are kind of diets which change. They're the flavor of the season, as I call them. Dikshit diet was very popular maybe a couple of years ago. Then there was keto diet, and at the moment, intermittent fasting seems to be the flavor of the season. Each diet has a different principle which it follows. Dikshit diet, the time was restricted. You could only have 2 meals. So automatically your caloric intake is restricted, because how much can you eat at 2 meals after all? And that was the theory that you will eat less because now you can only eat twice in a day. Keto diet eliminates entire food groups. You do not have minimum amount of carbohydrates, have a lot of fat. Now, this is a diet which is not sustainable. You can do it for a short period of time and you get great results. But your lipid profile, your cholesterol levels will just shoot up. We've seen it all the time. And most importantly, a vegetarian keto diet is very, very difficult to follow. So the thing is, it is not sustainable. And the intermittent fasting, the important thing there to remember is that you need to start early in the day. All the young girls are waking up late, skipping breakfast, starting their day at 1 o'clock, going up to 10 p.m. and saying that I'm following intermittent fasting. That is not intermittent fasting. You need to start your day early, 10 o'clock, 9 o'clock, 10 o'clock, and end the day early. Have your dinner by 6 or 7, maximum 7:38. But if you continue eating till 10 p.m., that is not IF. Also, the intermittent fasting has to be, it is calorie restricted intermittent fasting which gives results. Because if you think that in the 8 hours you can eat anything and everything, we have enough people who do not get results. So most importantly, you need to follow a dietary pattern which helps you change your lifestyle habits and is sustainable. Because this is, as the panelist said, doctor said, it's not something which is getting over in 6 weeks or 8 weeks. So we need a lifestyle modification.
Yeah, so basically there should be just not fasting in between meals. It's not that kind of fasting, and there has to be a timeline, which is very important, because we notice that these people, they study at night, or maybe they work at night, they work in shifts, and then they start the day very late. I think getting up at 12, 1 for students who are, especially this work from home culture, many a times it has brought about these certain changes in the entire way the lifestyle management goes nowadays. So coming to exercise again, what are the earliest impacts you see on people who are exercising? I mean, how do you see the effect of the exercise? And do you also come across some people who exercise and then they say that, okay, I've started developing pains or I have some injuries, and then they just back off, and then again it's very difficult to get them to start again?
Yes. When people come and when they come for an exercise program, generally, we do some kind of testing, which is our own testing, whether it's for flexibility or strength or cardiovascular fitness. Of course, when they come, we ask them about what, if there are any restrictions that they need to follow. And, if need be, we can even work in tandem with their doctor, but having said that, we try and, every person is different. There's not like one size that fits all. So each person is given maybe a separate program, and start them slow. Like I said, of course, we start with basic cardiovascular fitness, which is walking maybe, or like start them on a brisk walk, or like any cardio program, which maintains steady state, steady heart rate. Okay, that's actually a great way to start. Then, as you go along the program, you can kind of incorporate a lot of flexibility training, yoga, Pilates movements, core strengthening, because core strengthening is imperative. Sometimes we do have people who come with lower, kind of abdomen pain. So, and especially if they have their periods or their periods are approaching, then, we try not to do inversions with them, because we realize that inversions actually create more, just make them uncomfortable. So we try not to do inversions with them, at least during those few days. And, also people with PCOS, overtraining can be an issue. If you over-exercise or overtrain, then the symptoms can get aggravated. Because then what happens is, you have increased levels of cortisol, and it kind of, again, beats the purpose of what you're trying to do. So then, if weight loss is your goal, then you need to burn more calories. So say if on a particular day, if you've done a high intensity workout, like an HIIT workout, then the next 2 or 3 days, you do something which is called active recovery, wherein you maybe do 15-20 minutes of easy or moderate exercise, and then again go back to, so that's how the program, is monitored throughout the week. And, but by and large, movement every single day. So most, I think guidelines will tell you 150 minutes of exercise or movement per week, which is clearly not enough, I feel. That's barely 15 minutes of movement, 20 minutes of maybe getting your heart rate up per day, which is really very less for anybody, PCOS or no PCOS, it's just not enough. So,
like your motto says, it movement is a key. Keep moving.
Absolutely, So yeah.
That's really nice. Yes. Coming to Nagadeepti, Nagadeepti, nowadays we have women who are postponing their childbearing for a later age group. There are career concerns. There are so many concerns, and PCOS also, as we know, it is a lot of problems with ovulation, and they do not conceive. So, like you're working in IVF, a lot of people go for ART, reproductive techniques and all. How does it manifest in older women, and how do you deal with these older women? Do you do something more special for them, and what are the sequelae which can be, seen in these women?
Ma'am, basically, when we talk about age, the older woman, what we are more concerned if she's like a lady who has still not got married. If you're talking about like apart from 35, we all know that every lady is born with certain egg reserve. This is fixed at birth itself, which is going to reduce in every cycle of hers. So the question which comes into mind is if we are getting married late or we're delaying the childbearing or because of the career aspects or some other reason, what is the reserve? How much time do I have left in me? That is what is the question we should arise. And to add on it, we also have PCOS, which somewhere decreases the egg quality is what, depending upon the severity. So in such cases, we need to think of certain extra tests like something called as AMH, which is we generally use. So AMH basically it's a blood test where we check currently in that simple terms to say for the public, I would say it's a test to know how is the reserve of this lady, how much time is left. So if the reserve is on the lower side, it's like an indication, like please don't waste time, go hurry up, become pregnant as quick as possible. Because it just tells us about the reserve. It doesn't tell us about the quality. So if we are dealing with somebody who's of elder age group, and also to add on, we also have sonography, which will help us to see how many follicles are seen on each side. So now the follicles are basically structures which contain the egg in it. So if we are seeing as the lady becomes of a higher age, so the number of follicles what you are going to see on the lower side. So these all corresponding together, we can then plan, give her the treatment depending upon the severity. If suppose it is okay, borderline, we can generally think of doing something simple stimulation like there is something called as ovulation induction. So here the problem being anovulation in pieces, and that means she's not getting a regular cycle. That means the egg is not growing properly. So we put her on certain medications which are called as oral agents, which help the follicle egg to grow, which is then monitored by sonography. And then if the male partner analysis and even the tubes are open, because tubes are the place where the egg and the sperm meet. So they're all fine. We go for a simple treatment like have a timed intercourse. But if I see that the reserve is very much less, we have to pass forward with the process. So we think of something called as intrauterine insemination, where the partner semen sample is taken, washed, improved a little motility, and put directly into the uterus. But if the parameters are very deranged, like the AMH is very less, she's going to, there's always like, and she wants to naturally, every lady would want to become pregnant with her own eggs. So I would think it is better to jump into IVF as the option where we can increase the probability. And we also should not forget that nowadays we also have the option of egg freezing. So people who are currently more career oriented, who want to wait, delay the marriage, who want to see greater heights, it's absolutely fine. But please don't forget that you also have an option of egg freezing. That means that a lady of 28, 29, or even 24, 25, she can take her eggs out and keep it and just keep it. You get married at 33, you get married at 34, absolutely fine. Your eggs are of 23 and 24, a much better quality than what you would have. So this would be the way I would approach if a elderly lady, depending upon what are her reports, and also not to forget the husband parameter and the other female investigations.
That's a very important take-home message, Nagadeepti, because we are hearing so many of celebrities who are freezing their eggs. We have lately been having so many of babies who are, coming out of the frozen eggs. So this is one option which everybody should know, especially when the incidence of cancers is rising. Then, and people are opting to have children at a later age. So this is one option which we as doctors, it's our responsibility to give the options to the patient and they can choose. So there is a right to choose. So this is something which we can offer. Coming to Dr. Ankesh, why is it important to treat PCOS? I mean, why sometimes we say the girl is just young, so many people say shadi hoegi, when she gets married, we'll think about it when we are thinking of children. But what are the sequelae? What are the repercussions at an older age group? Why they should address it in the beginning itself?
Yeah, definitely, madam. It's very important to cure it. In America, they call PCOS as the diabetes of the ovary. So let's be honest. So it's a kind of diabetes with insulin resistance. More importantly, man, patients who have PCOS now in their 20s and 30s, if they're untreated with no lifestyle changes, with worsening lifestyles, with stress, with more work to do, more responsibilities, gaining weight, they develop metabolic syndrome, which is dyslipidemia, which is hypertension, obesity. All these things like dyslipidemia, hypertension, obesity with diabetes are also precursors for hyperestrogenism, which can cause endometrial cancer. So they can develop menorrhagia, they can develop a delayed menopause, they can develop postmenopausal bleeding, and endometrial carcinoma is a silent, killer also. It can directly spread into the uterine cavity, go to stages 1, 2, 3, and 4. So definitely, the worsening of PCOD or PCOS in the 40s and 50s would be metabolic syndrome, dyslipidemia, obesity, hypertension, diabetes. So none of these are good things to get. So I would say it's better to spend a few thousand rupees in your 20s and 30s, work on your fitness, your lifestyle, your diet, than spend lakhs on staying in an ICU and going towards your deathbed. I've always believed, investing your time and money in fitness and a good lifestyle, a good doctor, a good guide, mentor, then falling into the trap of going into a morbid state in your 60s and 70s. That's my thinking.
Absolutely, because once you get into this metabolic syndrome, then that is very difficult. I mean, you cannot reverse things.
Correct,
So
madam.
it's always prevention is better than cure. That is, of course, the golden rule. And coming to Niti, any functional foods or nutraceuticals which you feel can be helpful? People always want a quick fix. Okay, just give me something which I can have and lose weight and which will take care of my nutrition. That, like we say, Kalpavriksha, something you get from there. And what foods you think can be avoided?
So, as you mentioned, there is, as of now, no magic pill which gives you the quick results. In fact, there are a lot of girls who will come and say that I want to lose 10 kilos in 4 weeks, 6 weeks. And then we have to remind them that how long did you take to put on this weight, gain this weight? Now give yourself some time to lose that also. So, unfortunately, there are no magic portions of pills. But yes, one is that cut down on refined foods, refined and processed products. Very, very important. Cut down on your carbohydrates, step up your protein. There are a lot of supplements which are available in the market which are touted as PCOS supplements. There is evidence for cinnamon. So there is sufficient evidence that if you use cinnamon, which is dalchini, to the tune of 1.5 grams per day, which is basically a pinch, less than even half a teaspoon. So either you sprinkle it on your porridge or you sprinkle it on your coffee, can be useful. Fenugreek or methi seeds are known to reduce insulin, help insulin resistance. So that can be useful. And then there are products, there are chemicals, what we call inositol, which seems to be helping PCOS, but that is not something you take it by yourself. You need to visit your healthcare practitioner and then decide whether you want to take that or not. Sleep is another big issue which is disturbed in PCOS. So melatonin seems to help. Anything that helps you regularize your sleep cycle, besides getting off the Instagram and Facebook at night and the Netflix. Getting the sleep cycle right is very, very important in PCOS. Zinc, selenium, very important. Make sure to include nuts and seeds in your diet. For the non-vegetarians, it means seafood. If you have shellfish, again, very important. And step up the protein, whether you're vegetarian or non-vegetarian, very important.
It's a lovely, absolutely lovely answer. I think you've given everything. Do you come across anyone who has been so resistant to weight loss? They say, doctor, I'd rather go for bariatric surgery. And this is very difficult. So do you come across such people also in your practice?
Surely, there is, of course, a lot of resistance to bariatric surgery because after all, it's considered surgery. In fact, the majority who will say, I'm trying to do anything, but I don't want to go for surgery. And then there is this population, again, who's looking out for that quick fix and thinks that once I undergo a knife and everything will be hunky-dory. So I think these people need a lot of education. Even after bariatric surgery, there's a complete change in your eating habits, right? The volume decreases to just 60 to 80 ml. So it's not like you can start eating what you've been eating. So the commitment to a lifestyle change is important, whether you are considering bariatric surgery or you want to try the conventional weight loss method. Commitment is what is important because a lifestyle change will have to happen.
So this is very important to understand that even if anybody goes for a surgery, they have to maintain a sort of a regime even after that. It's not that they can just start eating everything after that. So that is something which they have to understand before they opt for any such drastic measures. So I would like you to give a take-home message from your side regarding PCOS, diet and PCOS.
Right. I think the most important thing is make time for yourself and commit to a lifestyle change. There is unfortunately no shortcut as for everything in life. Give yourself time, have patience, you will get the results.
I think cut down on Swiggy and Zomato to a certain extent because we have too many people just ordering food all the time.
I mean, I just came from the consult, that's why. And the last thing I told her is delete the app, delete the Zomato and Swiggy from your mobile. That was the last message that I gave her. Yeah.
That's really nice. So coming to Priti, so now you have to tell me about your kind of, tips which you would like to give us. What are the best 3 top tips you'd like to give us?
Okay, so the first would be include a variety of different kinds of workout in your program. Do some cardiovascular training at least 3 to 4 times a week, which is walk, run, swim, cycle for at least about 30 to 40 minutes. Include some strength training, which could be with resistance bands, with Thera resistance band, medicine balls, Swiss balls, using your own body weight, simple things like squats and lunges that will help you increase your muscle mass and also improve your BMR. Flexibility training, very, very important. So all these 3 will give you like a complete program where you're not only doing one kind of training, where you incorporate different kinds of training routines into your entire week. That is the first thing. Second thing is pick a time of day that you think you can stick to, because and pick an activity that you enjoy, because that is very important. You don't want to start and then give it up too soon, thinking it shouldn't seem like a chore. It should be something that you feel that, okay, I can carry this forward for the rest of my life. So start slow, start simple, but regularity is the key. You must be regular, and every single day keep aside that time, for exercise. Besides that, move throughout the day. And also, I do feel that if you engage people within your family, simple things like playing with your children or playing with, playing a game, going out into the garden and, getting physical activity back into our lives is just so important. If nothing, we all live in buildings, go up to your building terrace, if nothing, and just do a little, routine there. That's what we all did during COVID. I have kids in my building who are between the ages of about 18 to 28, 29. I say kids because for me, even 30 years old now today are kids. But I used to take them up to the terrace and I used to do training routines with them. In fact, quite a few of them did have PCOS as well. And, so I've worked very closely with them. And get your happy hormones going. That's really what exercise does for you.
Absolutely. So there is nothing like an excuse. 2 top excuses is I don't have time. Second is I don't have space.
Yes.
So and you don't need a gym. So you
absolutely
can given a complete prescription for exercise where you can do it on your own, in your own place and with your own body without any gadgets.
Nothing. You don't need any gadgets at all.
Absolutely. Very, very, very important. And a take-home message from Nagadeepti and Dr. Ankesh.
Nagadeepti can start,
Thank you. Basically being an IVF specialist, I would just say, as I had told earlier, please don't ignore the polycystic ovary. Like I have irregular menstrual cycle, I can take after marriage, I'll look into it, or after trying for 2 years. If you have irregular menstrual cycle and with the other features as mentioned before, you all have been trying, it has not happened in my, please visit the gynecologist or the fertility specialist. But along with that, not only you, the male partner has to be also evaluated equally. And always remember in mind of the egg freezing as an option for all the women who want to delay the fertility. At least find out where you all are standing and then plan accordingly.
Yes, don't wait till it's too late. Right. Dr. Ankesh?
Yeah, absolutely. I agree with Dr. Nagadeepti. Second, the last thing I would say is, for all the patients, everyone, please don't refer to Dr. Google. So they are Googling, they are Instagramming, they are seeing some Instagram, some influencer is who's very fit and hip and wearing a bathing suit, talking about her PCOD and how she's lost it. Don't go by her, please. God bless her, whoever she is, but don't follow all this you see on social media, internet. Please go to a professional, go to a doctor, go to someone who you have a good reference about, and then trust that person. Don't switch over and jump as if you can change, the brand of your clothes or something. So follow one person, follow one path, have some faith, have some patience. The patient should have some patience. And I have always been an advocate of medication for a very short time, but lifestyle, fitness, diet go a long. We all should follow it. For PCOS patients, they should be more strict with the diet, more strict with their workout. Even the lean PCOS patients should work out because the insulin resistance is there in the liver and the skeletal muscle, is something I've told everybody. So my advice is always follow a guru and go via the guru. Don't go via social media and the internet. That's all.
Absolutely. They say women have the last word in this panel. We have the absolutely dashing gynecologist who has the last word. So over to Vinita if there are any questions in the chat box.
Thank you so much, doctors. Oh my God, this was enlightening, and there were so many of the myths. I think a lot of people have replied, and they'll be clear right now after the session. But doctors, we have a lot of questions coming in right now as I speak to you. So I'm going to not waste more time because we don't have too much time. I have a question which is a lady actually sent me around 4 hours before the session started. So she's asked me that Shilpi Agrawal, she's mentioned, why am I finding it very difficult to lose weight? I have all the symptoms, whatever you asked, basically, they fill up a form online with whether you have hair and, stuff like how many periods in a year. So she says, I've got all the symptoms. So she's got PCOS. So how do I get a solution is she's asking. I'm finding it extremely difficult to lose it. She's not really mentioned her age or anything. She just asked, how can I lose weight? I'm finding it very difficult.
Yeah, so I think we'll direct this to Niti because, I think losing weight, it starts with what you put in your mouth. That translates into how it, affects your waist. So, Niti, how would you like to answer this?
Yeah, this is a very, very common question. And a lot of people want to think and believe that my weight is because of PCOS. And I'm not able to lose weight because I have PCOS. And we know it's a vicious cycle. The weight gain has actually aggravated the PCOS. And it's not the other way always. But yes, you need to have a relook at your diet by a professional. And maybe you're taking in not excess calories. The quantity may not be an issue, but the quality, as I mentioned, may be an issue. If your diet, the calories are coming mainly from carbohydrates and fat, saturated fat, and the protein component is low, then also you won't lose weight. So your diet needs to be closely looked at. We need to take your food recall, and of course, we also need to look at your physical activity levels.
I think that answers this completely. Yes, Vinita, any more questions?
Yes, Doc. I'm telling you, there are too many. Okay, there's another question now. I may pronounce this word wrong. So please bear with me. So she's asked, is myo-inositol and metformin together necessary, or only myo-inositol is enough?
Nagadeepti, would you like to answer that?
Sorry if I pronounced it wrong.
That's okay, yeah.
Yeah, I'll take the question, ma'am. Basically, inositols are needed, as said earlier by Niti madam also, that it acts in a different way. Basically, inositols will help in mediating the glucose uptake. I'm talking about little scientifically. Metformin is basically for insulin resistance. It also indirectly helps to lose the obesity and everything. Now, these are not like available over-the-counter drugs, or you just go and pop in inositol or metformin. So after analyzing, if your practitioner feels that metformin and myo-inositol is good, both along with it is metformin, yes, it's proven that it has helped in improvising the cycles. It has also helped in weight loss, and it has also helped in fertility and also during the management also. Inositol also, in some it has helped, in some not. So let the practitioner decide. But now, whether it's not a question whether both is needed or one is needed, kind of. It both have a little different roles to act in. Accordingly, that will be the answer for this question, which I would say.
So basically, this is something which the gynecologist has to decide. They are insulin sensitizers. They definitely help in PCOS. But when and how long and what is to be given has to be decided by the gynecologist.
Right. Great. The next question is, what is the reason behind periods being irregular? When I'm stressed, then periods come before cycle, even also sometimes daily. That didn't make sense. This is a question which one Miss Moni Rabba
Yeah, I think
has
she
mentioned.
means to say the cycles have become very irregular and, like
Okay.
maybe intermittent. So, Dr. Ankesh, would you like to take this, like, cycles becoming
madam.
very irregular and unpredictable?
Yeah, sure, madam. I'll take it. So, ma'am, ideally speaking, now the technique is to basically do a set of hormones. Now, the kind of hormone which I would advise is definitely do a prolactin, do a thyroid if she's obese, has family history of diabetes. I would even throw in a serum fasting, insulin fasting, blood sugar. If she has symptoms of abnormal hair growth, acne, sometimes I even do a serum-free testosterone for these patients. There's one way to do the blood tests, get the reports, then start her on medication. Or if the patient doesn't want to do the blood test, doesn't have the time, is lazy, then you start her on birth control pills. If the patient already has, symptoms of weight gain, bloating, she feels she's gained weight along with she's having PCOS, all the symptoms, you can start her on Diane 35, something that contains cypridone acetate. But if the patient has more of, sorry, for acne and all, I would start her on Diane 35. But if she has weight gain and things like that, I would start her on something like Yasmin or Doris, which has dosperidone to regularize the periods. But I'm a strong, I would advocate to use the blood test first. When the blood test method comes in, the reports come in, that's how we come to know more about the patient. And about the previous question about myoinositol versus metformin, I would not start metformin unless the patient has a raised serum fasting insulin. There's no indication to give insulin metformin. Yes, nowadays you can give the patient for any patient with PCOS on ultrasound or with symptoms, you can start her on basic myo with D-chiro-inositol. I think that helps with weight loss also, but nothing works until you work yourself, which I mean to say is lifestyle, workout, diet, exercise. Nothing happens. Now, there's no magic pill available. There's no magic sachet. These pharma companies have driven people wild with the number of products and sachet and capsule. And that day I got someone marketing a juice to me, Inos juice. So I was like, what are you saying? He's like, साहब बहुत tasty है, आप भी पी के देखो. So I was like, मैं क्यों पिएगा? He's like, साहब, we have cherry flavor, we have kala khatta, all these things. Inos juice. So I realized that this stage of this marketing has gone so far now with pharmas, you don't require unless it's indicated, and you shouldn't abuse yourself. Sorry, I diverted. But yeah, definitely I would start out on birth control pills or do the blood test, as I already said.
Basically, it is that all the treatment should be under supervision. It is not like do it yourself. Only do it yourself is diet and exercise. That also under supervision. Yes, anything related to exercise, I think, because a lot of people keep.
There are a lot of questions. I'm just going through all the questions to check anything related to, exercise related. Basically talking about, they've all asked questions about how to lose weight and stuff. It's very more or less a similar kind of questions. There is this one question: what if a woman taking steroids for some time, can it lead to the disease of PCOS, or whether it's a side effect the side effect causes PCOS is what she's asking. If she's taking steroids, basically, she's saying, if I take steroids, can it cause PCOS, or will PCOS be one of the side effects of taking steroids?
No, I don't think. Neither the steroid causes PCOS and nor is PCOS a side effect of steroids. PCOS is basically a complex heterogeneous endocrine disorder. So I think we'll leave that because then it will become very technical and very complicated. So basically it doesn't. That's it.
Right. And there is another one which says, I have had PCOS diagnosed very recently at the age of 32 after my marriage and after my first child. I am now getting all the symptoms. Please advise if any specific advice for my situation and age in particular.
So Nagadeepti already mentioned a little bit about this, but would you like to just elaborate a little more? Give her the answer.
Ma'am, now 32 again, the next question is whether she wants to plan a second child or whether she doesn't want to plan a second child. So if she's planning a second child, yes, please, if you're saying that you're going to have irregular menstrual cycles, then please visit a gynecologist, evaluate yourself to find out, and then accordingly plan the second baby. But if your concern is right now not regarding the fertility issue, it's just like the menstrual irregularities or the weight gain which you're having, or you're having symptoms like little male pattern hair growth or something like that, then accordingly, again, visit a gynecologist for the same thing, who will evaluate you in that manner and put you on either oral contraceptive pills, along with the first main and last, the lifestyle management, diet and exercises, which goes without actually saying. It should be part and part of everybody's routine life, I say.
So I think I'll just ask one question to Priti, because, exercise related, I get a lot of patients who ask these questions, that we have gone to so-and-so and they've told us there is PCOS specific exercises. A person who's doing only PCOS exercises. So do you have that kind of, you already said that you should walk, you've said whatever you should do. But yes, what are these specific PCOS exercises which some people market?
So, the specific PCOS exercises that some people market per se are Tai Chi, very mind-body kind of stuff, Pilates, Tai Chi, yoga, but very, not the very, intense yoga moves, but something that calms you down, because PCOS is associated with stress. So when you say, so something that will calm you down. So Pilates is, you're doing mat Pilates on the mat. So you're doing floor work, a lot of exercises on the floor where there's not very too much intense movement. Same thing with Tai Chi, where your movements are very fluid. They're very kind of slow and, movement with music. So it's a very mind-body kind of connection, neuromuscular movement kind of exercises. Very slow, very controlled. And one second. So very slow and controlled kind of exercises. So, but I really do feel like a combination will do you more good than exercises that are marketed for PCOS. Of course, the symptoms kind of do get you, your stress levels will come down, but that will happen even with other exercises, with anything else that you do. Your sleep cycles will become a lot better. Your sleep will kind of be more regular, more regulated. Your, even your hormone levels kind of get a little more stable. So exercise, by and large, per se, will do that. So walk, and what I personally believe in a lot is water therapy. If people can swim, so swimming is a wonderful, wonderful exercise, which kind of, so it gives you all the components of exercise. It gives you some amount of stretch. It gives you cardiovascular workout, and you get very gentle resistance from the water. It's extremely calming, and it gives you a great workout as well. So if I were to recommend one single exercise, I would recommend swimming. I'm a swimmer myself, so I would really think that being in the water is something just extremely, it's just very, very calming and really very beautiful. So I would suggest swimming.
Fantastic.
Great. So we also have we have a lot of questions coming in, but I'm just going to take the last two. Can less AMH levels of mother affect her girl child? Can she also have the same? Yeah.
Nagadeepti, what do you have to say about that?
Basically, whether less AMH is now at what age was this AMH done? That is the first question I would think of, because if AMH at which age? If it's like at post 40, the AMH is going to be on the lower side. But if the question is at the age of 25, 24, if a lady walks in saying, and we have done an AMH test, which says the ovarian reserve is low. So sometimes there can be genetic, whether any issues for which AMH was on the lower side. Then we get the karyotyping done. Now the second question, whether it passes on. Now PCOS and is like it has a little genetic basis involved in it. PCOS can pass on, but low AMH overall to pass on is not the question.
Yeah. So I think we have one more last, right?
Yeah, last. Actually, there are coming, as I said, but I don't think we have much more time. So this lady has asked, thank you so much for the informative discussion. Could you clarify the difference between PCOS and PCOD, and whether if can we conceive we have PCOD? or PCOS?
It's the same thing, yeah.
It is just the old terminology. Initially,
Yeah.
it was polycystic ovarian disease. Now it is called a syndrome because it is a multifaceted syndrome. And yes, you can conceive, but definitely you have to first do all these things which have been discussed, and then you need to ovulate, and then you can conceive. In case you can't ovulate in spite of all this, then you have to opt for any of the assisted reproductive techniques.
Right. One last question is coming. I want to take this is, what are the kind of mental stress occurs when, if you come to know that you have PCOS? Means, how do you deal with something like that, as the person is asking? How do you deal with like a mental stress on what should you do if you know you have PCOS and all these, like extra hair, not getting periods, all of this they're going through, your body is going through, especially for like a 22, 23-year-old who's going through it. How does she handle this entire situation?
I just leave it open to whoever wants to answer.
I'd like to say something on that.
First is, yeah, sure, madam, after you.
Sorry. Okay. So for me, I mean, a lot of times I take a lot of my students out in the open. Simple things like being with nature, barefoot walking on the grass helps a lot. Just getting out, go for a walk in the rain, things like that. I think it's wonderful when you get the elements of nature to work with you and get out there in the open. We have the rains coming in now. There are lovely places in and around Mumbai to go trekking. So maybe go and try one Sunday. It is just wonderful, and it keeps you going for the whole week. So try it. Yeah.
Nature is very therapeutic. I guess Dr. Ankesh was also wanted to.
I would say that anyone who has mental health symptoms because of the aesthetics and PCOD, first delete Instagram, delete social media. Don't look at all these posts of all these girls wearing all these clothes and all. It's half photoshopped. It's all fake. It's not the real. It's a bubble. It's not a real world. So delete social media. All these girls who are depressed because of PCOD and facial hair and acne and obesity, it is all to do with a social body dysmorphia syndrome, where they feel that they should look in a particular way. Their boyfriends feel they should look in a particular way. They themselves feel they should look more attractive, more beautiful, more slim, more sexy. ऐसा कुछ भी नहीं है. We are all human beings. The biggest problem with social media is people are only seeking validation and making others feel miserable. So that's the first thing I would say, delete social media.
That's a very good one.
That's the ugly truth, no?
It is the ugly truth. You're right.
Actual truth.
Absolutely. There are a lot of these things that are going on, and it's just so sad, how girls are dealing with it. It's really sad. But thank you so much, doctors. This has been great. Thank you, Dr. Sandhya, Dr. Ankesh, Priti, Dr. Nagadeepti, Mrs. Desai. This has been phenomenal. Means we've heard of all the questions you all have discussed. People are still messaging, I'm sorry, typing in questions, but we are running out of time completely. It's almost 4:10 now. So I'm not going to take more time. And we keep having these sessions once in a month. So keep looking out for us. The PCOS Society of India has our Instagram profile and on Facebook. So you can follow us. You can get details on that, on when is our next open forum. Please do join in. If you're a part of any of the corporates and you all want to do a session on that, please do get in touch with me, Vinita Mulchandani. The session has been brought to you by the PCOS Society of India, Dr. Darusha, who's the president of the PCOS Society, Miss Dr. Shobna Patar, who's also the chair in special interest group, Miss Ruby Sound, who's a co-chair, and the team of Vijayata. If there's anything, you can write to me, call me, anything. I'm here for you. And thank you so much, doctors. Goodbye. Thank you. God bless.
Thank you.